Hi, everyone. I see that we have so many people in the chat, which is super exciting, and all the participants. So if you don't mind, would you like to introduce yourself, say where you're from, like what state, and maybe your grade? So name, grade, and state.
And once we've had a chance to hear from some of you, we'll introduce ourselves too, but we're really excited to see you here. We've got lots of people coming online, lots of folks from Ohio. We've got California here, Oklahoma. Welcome, everyone. So as the chat keeps filling up, I'm going to go ahead and introduce myself. We'll get started here with the content of our webinar in just a minute. My name is Sarah Badawi. I'm a Senior Program Director at Constitutional Rights Foundation. And on behalf of all of us, I want to welcome you and thank you for joining us for this crash course in real time on public policy. I'll let my co-facilitator introduce herself.
Hi, everyone. My name is Sarah Kaufman. I'm a senior at Stoneman Douglas High School in Parkland, Florida, and I'm super excited to be joining you guys. I'm the co-founder of Empower the People, and we work a lot with Constitutional Rights Foundation. So I'm super excited that I get to speak to other youth, especially right now, since we're all stuck at home and not be able to like hang out with our friends. So yeah, I'm looking forward to today.
I'd like to give a special shout out among the folks from Ohio. I know that we have students and at least one teacher from Findlay High School in Findlay, Ohio, which is my alma mater of a very, very long time ago, and was a place where my US history, AP US history, and AP government classes kind of put me on the path for being here with you today. So I want to give a special shout out to the folks in Findlay and thank them for joining us. And with that, I think we'll go ahead and get started.
So a lot of people ask what public policy is, and a lot of times we use the word, or we see a lot of these words online, but we never really like take into account the actual definition. So public policy are laws, regulations, decisions, and actions that the government adopts to address problems. And here we're talking about government in many parts and at a lot of different levels. So things like legislatures and executives, so governors, mayors, and also bureaucracies, agencies that develop and enforce regulations. So it could include state departments of health or education. And a lot of times, almost every state government has adopted a public policy. And for example, most states have adopted the policy of banning texting while driving. This public policy addresses the problem of people causing car accidents because they are distracted. But it's important to know the difference between policy and goals. So policies and goals, a lot of times people think they're the same thing, but no, they're not. So to put this into perspective, people shouldn't text and drive is a goal, not a policy. Policies are the means of changing the goals. So in order to achieve the goals. And a lot of times, since I went to Stoneman Douglas High School, after the shooting 2 years ago, I got really involved in gun violence prevention. So I've been to my state capital in Florida to lobby legislators to develop public policy that can decrease the probability of school shootings. So like background checks is an example of a public policy. So the goal is to help stop school shootings, and then the public policy could be enacting background checks in a specific state. So that's the different examples of public policy. And right now, it's important to talk about public policy in the perspective regarding the COVID-19 pandemic. So when public policies go into effect, they can deeply affect people's lives. The current coronavirus is highlighting this to all of us on a daily basis. Due to the implementation of public policies, people can gain or lose significant things, such as jobs, services, and paid treatment. So in this quick crash course on policymaking and analysis today, we are going to take a closer look at some recent policy decisions in the state of Ohio to see a very clear illustration of how this is happening in real time. Like I was just talking about, there's a lot of different public policies, and especially right now with the coronavirus, there's public policies that are affecting our daily lives in the goal of stopping the spread of the coronavirus. So just looking at a few examples of some policies that have been adopted at the local, state, and federal levels, and also even by private companies to respond and confront the COVID-19 pandemic. So, for example, the private law policies are like Walmart will start checking workers' temperatures, providing protective gear. But more at the local level, tenants get help as LA freezes rent hikes for thousands of apartments over coronavirus. So you can see that it's affecting private companies. They're implementing policies, and then also state, local, and federal are implementing policies to stop the spread. So we would love if you could give us some examples of policies that have been created in your communities in response to the COVID-19 pandemic. So anything from private, local, state, federal. We would love if you type it in the chat box, some examples. Yeah, in Ohio, shelter-in-place orders, that's a good example, especially on the state level. Yeah, a lot of stay-at-home bans. A lot of you guys are saying that, definitely, and even local levels are enforcing it with their police department. So that's between state and local. So that's a good example. Oh, that's interesting that in Riverside, California, people must wear face coverings. They haven't done that in Florida yet, but that's a good idea, especially since the CDC is saying that. Yep, shutting down non-essential businesses, shutting down schools, that's all affecting all of us. Yep. Yeah, so you guys gave really good examples all the way from the local, state, and federal level. So I definitely think you see the difference between goals and public policy and why public policy is so important right now to hopefully stop and flatten the curve of the virus.
So those are all great examples that you guys have provided that kind of include, even amplify some of the examples that we've got here on the screen. One of the things that's kind of remarkable about this moment and why we wanted to take the opportunity to talk with you guys about public policy and public policy making and analysis right now is that it's happening so quickly. Usually under normal circumstances, policymakers, whether at the city level or the state level or the federal level, they usually have some time to develop policies. And so, but what we're finding right now is that really the sort of usual process of hashing out ideas and taking feedback and inviting public comment, none of those things are happening right now because policymaking is kind of happening more at like warp speed these days. So this is kind of how they're having to do it. But nonetheless, that's not going to stop us from picking it apart a little bit. So today we're going to analyze really carefully one particular policy issued by the state of Ohio a couple of weeks ago. And we're going to do it using a policy analysis tool that was developed by Constitutional Rights Foundation called GRADE. Some of you may have seen this before. If any of you have been involved with a Civic Action Project or CAP through Constitutional Rights Foundation, then this may look familiar, but some of you may not have seen this before. But basically, this is kind of the framework or the scorecard that we're going to use once we've looked at this case study of Ohio to kind of pick apart this policy, recognizing that things are moving very quickly, but that still the kind of feedback from citizens and analysis by citizens is really important, even in the midst of a crisis. So let's take a look quickly at the policy itself. The policy we're going to be analyzing using this GRADE checklist was issued by Governor Mike DeWine of Ohio on March 15th of this year. And it was basically the policy that, given where we are at this stage in the pandemic, this was, again, rewind to a few weeks ago, he said that Dr. Acton, who is the state director of health in Ohio, that Dr. Acton would be signing an order that all bars in the state and all restaurants would close at 9 o'clock that night, and that the order would be in effect for as long as it needed to be. Like in many places that have since issued similar orders, delivery and takeout were still permitted. But for the purposes of analysis, we're kind of like freezing the moment in time with this policy on March 15th. We already have the benefit of hindsight, and we'll talk about that a little bit later. But this is the policy we're going to be picking apart today. So you may or may not, depending on if you're on a phone or on a laptop or what you're using today, you may or may not have been able to see that grade policy analysis tool very well. Here's what the top part of it looks like. So the first thing when we're analyzing a policy, right, is to just be very clear about, okay, what's the policy that we're analyzing here? What's the policy that we're picking apart? Here it's pretty straightforward. Close all the bars and restaurants except for takeout and delivery. The other thing that's really important to consider when you're analyzing policy is to take into account what level of government and what part of the government or what institution is involved in the policy. Like Sari mentioned before, one of the many things that's so remarkable about this time and this moment of this pandemic is that these changes and policy things are happening at every level of government, which in the United States, because of our federal system, I think we've seen, if you've been following the news, can make things a little bit messy. So it's important to be clear when you're analyzing a policy, okay, what level of government are we talking about? The policy we're analyzing here today is a state policy, right, issued by the governor or sort of approved by the governor, but officially signed by the director of the State Department of Health in Ohio. So both of those people, the governor and Dr. Acton, are representatives of the executive branch in Ohio, right, of the state level government. The other thing you need to look at when you're analyzing a policy, because this is really going to be the criteria on which you judge it, is what's its goal? What's it trying to accomplish? Sari mentioned before, you know, a policy isn't the same as a goal, but policies do have goals, right? They have a purpose. They have something that they're trying to achieve. And in this case, we know, and we'll hear a little bit more in a clip I'm going to show you in a second from Governor DeWine and from Dr. Acton, the goal of this policy is to increase physical distancing in order to slow the spread of COVID-19, right? It's very clear. It's quite straightforward in that sense, although it's a sweeping policy. So again, when we're going to analyze a policy, part of evaluating it is going to be taking into account its goal and how good a job it does of achieving its goal. So without further ado, I'm going to take us to a clip. Oh, actually, I'm going to give you one quick heads up first. So for those of you who can, we're going to be working in a Google Doc a little bit later once we start actually picking apart this policy, once we've heard more about it in these video clips. They're kind of like our video case study. But if you, for whatever reason, can't or don't want to work in the Google Doc, that's totally fine. If you just have a piece of paper next to you with grade written up and down along the left-hand side, that's really all you need to participate in this. So, and you can feel free to send us a screenshot of it or send us a picture of it if that's what you end up using. So don't worry if you can't access a Google Doc. It's no big deal. So let's take a look at what the governor actually said when he announced this policy.
I have some understanding of what this order will do. And I think of all the places that I've eaten across the state of Ohio, many small business owners who this is going to hurt greatly. I'm also aware of the many fine people who work in these establishments, work in these restaurants, work in the bars, who will not have a job. I'm going to ask in a moment the Lieutenant Governor to talk about some of the things that we're going to do, and there will be more to try to mitigate this and mitigate the suffering. But I understand, have some idea of that suffering, and I can't tell you how sorry I am. Our goal is for everyone get through this. What we wish is that next St. Patrick's Day, everyone will be there. And they'll have the opportunity to celebrate St. Patrick's Day, but not only that, they'll have the opportunity to live their life and live their American dream. But if people are not around, they can't do that. And so this is a very, very crucial time. Delay means more people will die. Literally every day we delay, the data clearly shows that more people will die. It is not just only a question about people dying from this pandemic, from the coronavirus. It is also a case that if we do not act and stop and break up these groups and get some distance, people, if we do not do that, our healthcare system in the state of Ohio will not hold up.
So I'm going to pause it right there just for a second. That's just the first piece of the governor's statement. We're going to hear from the lieutenant governor and from Dr. Acton in just a moment. But I want to go back to take a closer look at grade very quickly so that you have something in mind that I want you to kind of be listening for, especially during the presentation or the clip we're going to watch of the lieutenant governor. I kind of zipped through grade earlier without pointing out what each letter in this acronym stand for. We talked about the goals already, but part of looking at a policy is also looking at these other aspects of it. So once you've clarified what the goal of the policy is, as you're going to pick it apart, it's important to consider that R, the rivals and supporters. Who are the people who are going to be supportive of this? Who are the people who are not? Okay. The A is advantages. What's good about the policy? D, not surprisingly, are the disadvantages. What's not so great about the policy? What are some of the downsides? And we'll look at these a little bit more closely when we get into this Google Doc a little bit later. And then the final part of grade is the evaluation. We've got to evaluate the policy. Overall, is this a good policy or not such a great policy, and why? So hopefully you heard already some of those things in what the governor said. And that's what I want you to be on the lookout for when we listen to Dr. Acton and Lieutenant Governor Husted in this next clip, because this grade is what we'll be reporting back out on in the Google Doc in just a couple of minutes. So sorry to have to jump ahead here. So this is the next clip that we're gonna see.
But if it is not essential, you should not be doing it. And young people, you know, you're part of this, absolutely part of what I'm talking about. And we'll have more communications on how you can help during this, because we're gonna need your help as well. This is disproportionately going to hit the most vulnerable amongst us. There is no doubt of that. We've predicted this all along. All over this state, philanthropies and nonprofits are working tirelessly. We're going to work on the needs of the homeless population. We're going to work on all of this. And these policies will layer on day after day. We won't have them all in the big day, but the state of Ohio has moved all the big rocks, the most important breaks we can put on spread, and we'll keep layering those on day by day. And as the Lieutenant Governor will share with you, we will keep building supports. But please know, everyone, this is the real thing. This is not a drill. This is the once-in-a-lifetime pandemic, and everything each of us does matters.
Good afternoon. I would like to reiterate a couple of things that the governor and Dr. Acton talked about. First, though, I want to thank the Restaurant Association and the restaurants and bar owners who spent time with us today, helping us work through these policies to make them as impactful from the standpoint of health benefits and also helped us work through how we can minimize the economic consequences of these decisions. As the governor reiterated, this was a very difficult decision. We know how difficult it is on business owners and their employees. I also want to emphasize that carry out and delivery are available options. You will want to continue to use these institutions, these businesses for that purpose. We don't want everybody to stop buying restaurant food and start going to the grocery store. That will create problems of its own. Continue to use your local restaurants for food and delivery services, carry out food delivery services. But as we have discussed, this will have an impact. And so the governor is going to sign an executive order regarding unemployment compensation. This will assist Ohio workers directly impacted by the COVID-19 health emergency. He will be issuing this executive order that will make several changes to Ohio's unemployment law and state agency policy to enable workers who do not have paid leave benefits to access unemployment benefits during this period of emergency. We will be broadening the current state policy to clarify that individuals that are quarantined by a health professional or by their employer are considered to be unemployed and will not be subject to the requirements to actively seek work during the period of this emergency. This also applies to companies that determine it is necessary to temporarily shut down operations due to the current emergency. Ohio currently has a 1-week waiting period before an individual can receive unemployment benefits. In the order, it will expedite payments to impacted Ohioans, and we will be waiving that delay, that 1-week delay for eligible workers to receive their first week's unemployment payments and applications. Because we do not want to penalize individual employers for the impact of this outbreak by increasing their future unemployment taxes, the cost of these additional benefits will be mutualized. The Ohio Department.
You heard from the governor, from the director of the Ohio Department of Health, and from the lieutenant governor. So what we're going to do now is dig in a little bit more into our video case study of this policy. You should be able to see the bottom part of the grade analysis tool on your screen now. You should also see in the chat a link to a Google Doc that I'm going to open in just a second, where we want to hear from you. We want to hear what you heard in these presentations, and you can sort of feel free to jump in where things stood out to you. We'll move through them in order in the Google Doc, but we definitely want to hear from you. So we'll start by looking at who might support this policy and who might oppose it. Just if we could get a couple of answers in there about rivals and supporters, either folks who you can think of or folks who were mentioned in the video. And I know there are a lot of us on here, so it might get a little chaotic in the Google Doc. That's fine. We can still pull out the highlights, no worries. So yeah, the lieutenant governor mentioned the support, having had the support of the Restaurant Association as they were developing the policy. But someone's pointing out also in the Google Doc that small business owners are going to be hurt by this, like the governor said right off the bat. So that's definitely going to be someone who's going to struggle with this. Absolutely. And the same goes, as we're talking about rivals, the same goes for people like wait staff, bartenders, cooks, people who work in these restaurants, which employ a lot of people, not just in Ohio, but across the United States. We're seeing this, right? These are people who could seriously oppose this policy because it's going to affect them very negatively, very seriously. So we'll move on to some of the advantages. Someone's typing in an answer now. And for the advantages, what we're trying to look at are what's good about the policy. Like, does it do a good job of addressing the causes or the effects, of the problem that it's meant to address? Is it likely to actually achieve its goal? Is it inexpensive? Does it protect people from harm or from damage? Does it ensure people's liberties? These are the kinds of measures that we use when we're analyzing policy. So one advantage, or one point on the advantages, is that we've got a few answers coming into the Google Sheet now. That one advantage is that it might keep people safe, but it's going to hurt them economically. It is protective against the spread of the disease, but it comes at a great cost. Someone mentioned in analyzing the advantages that they're not sure that the effects are being addressed because that's not what their primary focus is, right? And they did stress that at the end of the day, the reason for making this policy is to keep people from getting sick. We'll talk in a little bit about how they try to mitigate some of the downside of that. But those are really important factors that we have to take into account. So the disadvantages, what's not so great about this policy? Does it fail to address the causes or the effects of the problem? Is it inefficient? Is it expensive? Does it cause harm or damage? Does it intrude on people's liberties? And people are weighing in the Google Sheet, and please feel free to keep adding to previous entries as well. We definitely want to take your ideas, and we'll boil these down into a document that we'll share with you after the webinar as well. So please keep adding as you think of things. We're just going to keep moving through it to keep us moving through this lesson. So for the disadvantages, folks are pointing out in the Google Doc that it does make it harder for people who make their money for tips, for example. But what someone's saying in the Google Doc is that it does address that disadvantage by dealing in the same press conference with how they're going to handle new unemployment claims, and also by encouraging people to keep going to restaurants. People are mentioning in the disadvantages that for college students who are furloughed by college students who may work in a restaurant and aren't able to continue that work, they may fall into a different category of whether or not they qualify for unemployment because they're a full-time student. One person points out in the disadvantages that small mom and pop places still might not be able to recover, even with the safeguards that the Lieutenant Governor mentioned. So finally, let's look at the E in grade and evaluate the policy overall. And then I'm going to once we get out of the Google Doc, I'm going to hand you back to Sari to debrief a little bit. And then we're going to give you guys a chance to weigh in, because we really want to hear what you think, not just about this policy, but about how things are going in general. So for the overall assessment of this policy, you have to ask yourself, okay, overall, is this policy a good one? Why or why not? You've got to weigh the advantages versus the disadvantages. And if you want to say there are too many disadvantages, then it's worth considering if you can think of some other policy, some alternative policy response that might be more effective. So what we're hearing in the Google Doc is that ultimately, yes, it's effective at keeping people safe, and that a policy that, if we're evaluating this policy in particular, we have reason to believe that it should be effective given the timing, given how early Governor DeWine made this move. And we're going to talk a little bit more about how the timeline has been very different in other states. Feel free to keep writing there. We're going to go back to kind of try to tie this all together, not just with the case of Ohio, but really looking across the country a little bit more. So I'll hand you back over to Sari.
Well, that was great that we were all able to grade it and evaluate the policy. Honestly, like after doing that, today I listened to Governor DeSantis, my governor of Florida, do his conference, and then I was like also thinking of the advantages and disadvantages and how it affected different people. So it's important always like thinking in that perspective when listening to your local, state, and federal officials, especially since they're definitely all over social media, online, and news right now. And it's important to listen to them. To bring it all together, there's going to be like different questions that will pop up. Sarah, do you mind starting to pop up some of the questions? So if you guys want to write in the chat some of your answers, then we can really talk about not just like how to evaluate it, but also what's going on in your state and kind of comparing the similarities between what's happening, even if you're in Ohio, like maybe going a little deeper and explaining the specific effects of your policy. And then if you're in other states, comparing your state's policy to Ohio's policy. Also, questions to think over, like what did you think Dr. Acton meant when she talked about policies layering on day after day? Does that mean like there's going to be more policies every day? Does that mean they're going to slow down? That's like a really good question. You can answer in the chat. We'd love to make this as interactive as possible. Also, another question that's important to think about is, what did Lieutenant Governor Huston announce to address problems that would be created by the new policy? And then how does the Ohio policy from March 15th compare to what's been done in your state? So you can answer any of these questions. We really like that, or just explaining what's going on in your own community compared to the press conference that you watched. And then also here's some more questions to think about and answer in the chat box. Are there coronavirus related policies in your state and community that you agree with? Are there ones that you disagree with? Probably some of them are upsetting, like especially I'm a senior, so for school to be closed, I won't have a graduation. So that's definitely upsetting for me. Are there other coronavirus related policies that you think should be implemented in your state community? For example, my state took a really long time to finally shut down the beaches. So we had a lot of spring breakers on our coast that were spreading the virus even more. And should all states have a stay at home order, or should the federal government order it for all states? Why or why not? So if you guys don't mind starting to answer some of these questions in the chat box, we'd really appreciate it. And I'll talk about some of your answers. So the first question, that layering policies day after day leaves the door open for future changes, probably to avoid later accusations about violating the original action. So that's a really good answer, especially right now. A lot of the data that we're finding is changing every day, so the response from officials are changing every day. So it definitely leaves room for officials to alter, their first policy. That's interesting. Katie, you said, I'm assuming you're from Ohio, said that Ohio has added new restrictive policies almost every day. They're closing salons, they're closing all non-essential workers, and 2 p.m. every day, your governor is having a press conference. So again, since it's changing so frequently, that's interesting. So someone from Missouri, Alex, you're saying that a lot of people are still holding out hope. Wow, your restaurants have not been closed. That's interesting. And that's not good. You saw a crowded Chipotle. But yeah, it's interesting to see different states like New York, since it's super dense, they had to act so quickly, and maybe Missouri, since it's less dense, the disease might not be spreading as quickly, but it definitely is interesting to see the different states' responses. And also, it's a good question to ask, like, should all states order a stay-at-home order, or should the federal government do it for states? That's, also going into the question of federalism and the relationship between the federal government and state government. So you guys also want to answer that, that would be good.
Yeah, if I can just chime in, because we have such a mix of folks from such a mix of states on here, I think we're especially interested in what you as students of government, or just as students, as young people, think about this question, because it's one that's coming up a lot in the news. This question of, should all states have a stay-at-home order? Because right now, I think there are about 9 that have not issued yet a statewide stay-at-home order. And if, for those that haven't, if the federal government should order it for all states, why or why not? I mean, this is really at the heart, a question really at the heart of our federal system. So we'd love to hear what you think about that in particular.
So Katie, you bring up a good point that maybe only states should be able to decide, because some states have to respond differently. You said like some rural areas are more spread out and then cities are more done. So that's a good point. Evelyn, you also agree that it should be state by state, smaller and larger states. That's a big difference between our geography in a lot of different states. So you guys are making good points.
I'll explain to you how this last slide works. You've probably seen this before in your classes, but in case you haven't, we're asking you to weigh in on a poll here from Poll Everywhere. So if you're able to use your phone to send a text message, please text CRF USA to 37607, and that'll let you kind of join our poll, and then you can text your answer. You can also answer online at pollev.com/CRFUSA. And here's what we'd like to hear from you. If you could tell a policymaker one word about your experience during this pandemic, what would it be? Imagine you have the ear of Governor DeWine, or your governor, or the president, or your mayor, or any other policymaker you can think of. What would you want them to hear from you in one word?
I just want to thank everyone so much for coming on. I actually have a class, you guys can all relate, so I have to leave early. But thank you guys for all participating, and it was awesome getting to know all of you.
Okay, we've got bored and fascinating. I know it's tricky to put it into one word. A lot of people are having to make adjustments, for sure. It's definitely a unique time, there's no doubt about that. I think these are going to populate by, they're going to change size depending on frequency. So board is getting pretty big. And we know that's real for you guys. That's partly why we wanted to bring this webinar to you today, to hear from Sari, not just from me, and to try to find a way to kind of use your brains and think about this pandemic maybe in a slightly different way. Because we know that it has been sad and scary and exhausting. And please keep the answers coming. We know that these are really unprecedented and unusual times. But I'm glad if some of you are able to make the most of it. For it to be restful sometimes, to take walks. And it can be revolutionary. I think that's very true. That's partly why we wanted to talk with you guys about policy today, because I think this is a conversation we're going to all need to keep going. Big policy changes have come in the United States out of massive crises, right? I'm sure you've all studied in school about the New Deal and that package of policies that came during and after the Great Depression, right? These sort of very extreme times lead to often very revolutionary changes. So I think as as students and as participants in this democracy, we're going to need to stay engaged for sure as we continue to go through this experience together, and when we come out on the other side. So thank you for your thoughtful participation today. Thanks for taking the time. I hope it gave you a little bit of a break from the boredom and the monotony. I hope it gives you something to take back to your classes and to your communities. Please stay in touch with us. You can find us at across social media. We're at CRF USA on Instagram, Twitter, and Facebook. You can also find our website, crf-usa.org, and our website of our Civic Action Project, which is crfcap.org. Empower the People, which is Sari's organization that she co-founded with Casey Sherman, is Empower the People, and they are at ETP Now across social media. So please stay in touch, stay safe, and we'll look forward to hearing from you again soon. Stay tuned and take care.